Awesome. Okay, well, welcome to our study group. We really appreciate having Samantha Leonard on from Stream Dental HR, and she's going to go over some occupational health and safety for us. Now we know it's a requirement through the ADA&C, and just kind of give us a rundown of the things that we may have, the things we may be missing, all the good stuff that needs to happen, and just get an idea of kind of what is coming on with the new legislation and how we can make our clinics up to code. So I'll turn the time over to you, Samantha, and you can let us know what you have going on.
Great. Well, thank you, Teresa and Brittany, for organizing all of this and for you guys spending your Monday evening with me. Hopefully you've got a nice little glass of wine or, some bourbon, whatever you want to be able to just enjoy this information and this evening. I am going to be going over a lot of information just because, like Teresa had mentioned, there's just so much when it comes to health and safety. And we want to make sure that all practices are compliant. They're up to date with the legislation and employment standards because health and safety is the law. And before we jump in, I'm just going to kind of go over and do a quick little introduction of who I am. So I'm the CEO and co-founder of Stream Dental HR. I previously was a dental assistant. I did that for 5 years, and then I jumped into office management. When I started office management, I was just started this one startup practice where I was the only employee. And then shortly after, we turned into a multi-million-dollar clinic, and we just continued expanding the owner's empire. So we went from one office to 6 practices across the country. And as the practice grew, so did my team, and so did HR problems. And when it came to searching for solutions, there wasn't really anything out there that was supporting our industry. So that's where we decided to start this company about 6 years ago. And so far, we've continued to grow and have helped hundreds of practices across Canada and the United States. So we really want to help your office, not only just with health and safety, but we can also support when it comes to HR, infection prevention and control, engaging your team members and helping put all the systems in place to be able to support your team and manage your human capital. All right, so without further ado, let's jump into occupational health and safety. So health and safety programs are really designed to do exactly that. Keep your team healthy and safe. And it's really meant to prevent any workplace illnesses, injuries, and of course, to prevent any sort of deaths. Now, this is a requirement by law to comply with safety and employment standards in order to really operate any type of business within Alberta. Now, I know when we hear about occupational health and safety, we really think about like big companies like construction companies or maybe the oil and gas industry. They're dealing with heavy duty machinery. And, we hear about instances where people have lost a limb or they have died. But dental workers are exposed to several biological, physical, chemical, or psychological hazards. So for example, when we're thinking of biological, we can easily come up with and identify a few hazards. For example, we're working with a widespread population, and we're seeing dozens and dozens of patients every single day, every hour probably. And so we're constantly exposed to infectious diseases like bloodborne diseases or respiratory diseases or things like COVID-19 now. And when one employee potentially, we're thinking about what we're living in right now, we have one employee that potentially exposes patients, they expose the rest of your employees. And now we have a potential outbreak in the office. So of course, COVID-19 is definitely top of mind, which is why health and safety regulations and inspections have increased substantially over this last year. Then we have things like chemical hazards. So think about it. We deal with several chemicals day in and day out. And now what if we contact one of those chemicals came into contact with our skin or with our eyes, and now we have a severe chemical burn. Or if your practice has compressed gases like nitrous or oxygen, and what if the valve wasn't closed all the way? Or what if it was leaking? Then we have physical hazards. Many of the tools we use scrape plaque. They, drill holes. They're sharp. So there could be potential hazards of either injuring ourselves with that. Or for example, if there's a needle stick prick injury, we could be exposed to HIV or hepatitis. Or what about an employee who's working alone in the practice? As in, maybe they're not physically alone, but maybe they're covering the phones in the front desk while everybody else is having lunch in the back room. In the eyes of the law, they are technically alone. And what happens if an unauthorized intruder comes in or a robbery occurs? Then we have the psychological hazards. Now, these are things like bullying or workplace violence. And, we've seen this happen before or heard of other practices where there's been bullying between employees, and there's been harassment claims, or worse, sexual harassment. We just saw in the last updater with the ADA&C, a practice owner license was actually suspended because of sexual harassment in the workplace. So as you can tell, health and safety is necessary for dental offices, and not just big industries like construction or oil and gas. And this program is designed to protect everyone in the workplace. And Part 1 of the Occupational Health and Safety Act defines the roles and responsibilities for each member of the workplace. So when we think about that within our office, we have 3 different categories. We have 1, which is the employer. Now, their responsibility is to ensure that everybody's health and safety and welfare are taken care of, not only within the office, but around the vicinity of the practice. They need to make the employees aware of their rights, their responsibilities. They need to protect them from sexual harassment or from violence in the workplace. They need to train their employees so that they understand how to perform their duties properly and safely, and making sure that the equipment is always safe. They also need to comply with health and safety legislations. But you, as office managers, you also fall under this category as well as the supervisor, because you are in charge of the work site and you are in charge of the workers. So that means that you need to protect their health and safety as well. You need to make sure that everybody is following all of these in a safe manner, and they're following all of the, not only the OH&S legislation, but also the pieces that you have put together to be able to keep everybody safe. And then, of course, the workers are also responsible for making sure that they're protecting not only themselves, but the rest of the team, that they're cooperating, they're complying, they're wearing the proper PPE, and they're refraining from participating or causing any harassment or violence to the rest of the team members. So everybody is involved in the health and safety. It's a team effort. And every work site is responsible to be able to provide those necessary policies and protocols to ensure that everybody understands their rights. They can refuse dangerous workplaces, and they make sure that they have that knowledge to be able to enforce proper care and safety. So in other words, everybody needs to know the law. So a simple 1 sentence or verbal policy and procedure is not sufficient enough to have within your health and safety program. Because remember, this is involving injury, illness, and death. So what does a practice need to be compliant with all of these pieces? So we're going to dive into 8 key fundamental pieces and do a quick high-level overview of all of these items. So first and foremost, we want to make sure that they have a health and safety manual. Now, that health and safety manual is a compilation of all of your policies and procedures that you have enforced to be able to protect and maintain the health and safety of everybody in your practice. It also is a critical component and a critical step that you are taking to be able to keep everybody safe. Right? And your health and safety policies must state the protection, the maintenance of the health care workers within your office. And it should also show your commitment to health and safety, the organization's health and safety goals, and the responsibilities for everybody involved. Now, these need to be office specific. Now, we see so many times where practices I've talked to many offices where they say that, yes, I have a health and safety manual. And when we're doing our health and safety checkup, I take a look at the manual, and it's basically just the template that has been provided from Alberta Health Services for dental workers. Now, on the very first paragraph, it says that this is just a guide, and you must take this and actually create this specifically for your office. Now, not only does it have to be practice specific, but you need to make sure that it's compliant with federal, provincial, and municipal regulations. Because according to the OH&S Act, Part 2, Section 4, every employer shall keep readily available all health and safety information about the workplace hazards and the controls that are using to eliminate or control those hazards and any relevant workplace practices and procedures. Now, this manual should discuss safe work practices. So it should talk about your elimination processes, your communication processes for things like if people are working alone. If somebody is coming into the office earlier or staying later to be able to finish up work, that person is working alone. Or like we discussed, if they're going to be covering the phones by themselves or be at a point in time when they are alone without anybody able to see or hear what is happening in the area. You need to have respectful workplace policies, housekeeping and hygiene policies, what you are doing to inspect and audit and your due diligence process to make sure that we are constantly on top of the health and safety procedures within our practice. You need to discuss risk assessments, procedures, hazards if somebody, for example, is driving back and forth, running errands for the practice. Not only does that, health and safety policies involve the work site, but if that person is conducting work within that vehicle, that is technically a work site. So we need to make sure that we are covering all of those bases. Even if somebody's working from home, we need to make sure that they are in a healthy environment. So that can include domestic violence as well, or harassment within the household. So there are so many layers that are covered in that occupational health and safety. Now, just a few pieces that I just talked about, that's literally the first section that we have in our OH&S manual, and that covers 20 pages of 113 pages. So pretty robust piece that we have. The next layer that a practice needs to have is making sure that they have a health and safety representative. Now, this person is essentially that. They're the one person in the office who essentially is responsible for promoting the awareness and the interest of health and safety and preventing illnesses and injuries with people within our work site. Now, it's up to the workers to select that health and safety representative. So unfortunately, it's somebody who can't be volunteered, or management cannot be involved in this, or supervisors. It's somebody that needs to be elected by another peer. Because when you think about it, that health and safety representative essentially is representing the workers. Everybody who's working inside and doing all of the tasks day in and day out. They need to make sure that they're protecting not only themselves, but everybody that's involved. Now, if a practice has more than 20 employees, now a health and safety committee is enforced. Now, this health and safety committee will involve both the workers and the employer representative. So essentially, it's a group who are working together to make sure we're compliant, we're working together to enforce and enact all of these. So when we're thinking about this committee, it actually requires, it's a total of 4 members. Now, two of them represent the workers, and then the other are 2 co-chairs. Now, one needs to be representative of the worker and one needs to be representative of the management. So as you can tell, there's a lot that's involved, not only just with selecting and electing and having a health and safety committee, but quarterly meetings must be conducted and a minute book must be held. And in fact, with the OH&S legislation, they don't even consider any type of meeting unless there's a documentation, there's an agenda, everybody signed off on it, and there are meeting notes. Other than that, it's like the saying that we have in HR, if it's not documented, it never happened. So you want to make sure that if you do have a health and safety committee, that we do have that documentations of those quarterly meetings and those minute books. Now, not only are they involved in just enforcing and reviewing the health and safety in the office, but also they must conduct risk assessments. So now, like we originally discussed, a few hazards that we can think of from the top of our mind of what exists within dental practices. So they need to make sure that either annually or anytime a new like chemical or equipment or procedure or instrument or anything like that, a new hazard, let's call it, is introduced into the workplace, then a risk assessment, or also known as a hazard assessment, must be conducted. Now, a hazard, when we talked about it, is a situation, it's a condition, or it's a thing that can be dangerous to the health and safety of our employees. So common hazards are, maybe when we're carrying something really heavy, or if there's a slip, trip, or fall, or if we're working alone, or if there's harassment, or maybe those hazardous chemicals. Because if any of those items are left unchecked, then the potential, if we think about it, can be quite large. We could have an injury, or if somebody slips, they can break an arm. Or if there is a medical emergency, or it causes absenteeism. So now somebody hurt themselves and they can't come to the office for the next 4 months because they have a broken arm, or we have chemical burns. So it's their responsibility as health and safety representatives to make sure that they are identifying, they're eliminating, and they're controlling these hazards. So when they're conducting those hazard assessments, again, this could be done a minimum once a year or anytime there's a new hazard that's introduced, then what they need to do is they need to assess the work site and identify those existing hazards. So they need to take a look at all of the individual tasks that each job involves. So it's not just a simple checklist and going through. They actually have to assess all of the tasks that are involved in every position in the practice. They need to look for any health or safety hazards relating to those tasks. So again, using that criteria, biological, physical, chemical, psychological, they need to figure out what they need to do to eliminate each of those hazards. If that's not possible, how are we going to control it? Then they need to take that information and implement the controls. And then they need to write down all of the new hazards that were found and the new policies and procedures. And then they need to continue to monitor that on a regular basis, like we discussed, either annually or when there's a change. And then essentially they need to rinse and repeat for every position in the practice. So in other words, one for hygienists, one for assistants, one for office managers, associates, so on and so forth. Now that's just part one of conducting a hazard or a risk assessment. Part two is that each employee actually has to do a self-assessment. So now they need to do the exact same exercise. And by doing that, we are cross-comparing not only what the health and safety representative or committee has done, but also those self-hazard assessments. So in that way, they are covering all potential hazards that could happen within that workplace. And now they also need to prepare that report. So definitely a lot of work that's involved, but making sure that you have the right documentations, the right report forms. Because let me tell you, when we were helping those offices going through inspections that started back in June, that was one of the first pieces they asked for. Show me all of your hazard assessments. Now they are expecting to see logs, they are expecting to see sign-offs, they are expecting to see policies and report forms that go along with that. So in that way, all of those areas are covered and your team is protected. Then we'll move on to emergency response plans. Now, like we talked about, quite a few hazards that could happen that could lead to an emergency, but there are also other situations that could happen that's outside of our control that are categorized as emergencies. So in the Occupational Health and Safety Code, Part 7, Section 115, it says an employer must establish an emergency response plan for any and all potential emergencies. So in other words, we need to anticipate and address anything that could realistically happen within the workplace, like fires, extreme weather, floods, emergency procedures, unauthorized intruders, robberies, bomb threats, medical emergencies. And now, not only does that emergency response plan need to address, hey, if there is a fire, here's what we need to do, but it also needs to outline not only the people that are involved. So who do we need to contact if this emergency happens? We need to make sure that we have that contact information readily available. Just like they teach us in CPR, in those emergency situations, we need to know, who do we need to contact and what do we need to jump in and do next? So you need to have the proper outline for the people that need to be contacted, the resources to be able to help with this emergency, and the procedures on how to deal with such emergencies. So we can really see the value of this because, of course, we don't want to wait until there's a crazy situation and, our office is being robbed right now and we don't know what to do. We need to make sure that we have this in place. The Employees have reviewed it annually because this is health and safety needs to be reviewed annually with our employees. But we also need to run emergency drills. Now, that's also something that, we think about emergency drills. We think about when we were back in school, that stupid fire alarm would go off and we'd have to walk outside and, stand outside in the cold until we were let back in. But those fire drills were there for a reason. If there was ever a fire, it was literally ingrained in us in what we needed to do. And it's the same thing with our team. We hope that we never have to deal with this type of situation. But if we do, the team have run these drills. The Health and Safety Committee has made sure that these policies are all up to date. They have trained and equipped all of their team members, and that plan is readily available. Now, if your office is actually offers sedation dentistry, then you have an even bigger emergency response plan. And your drills have to be conducted every 6 months, and it has to be documented. And this is another layer that is now required if your practice is here in Alberta. That's a part of the practice permit renewal process and a requirement for you to be doing that every 6 months. All right, I think we're halfway there. Workplace injury programs. Now, we've talked about some hazards that could potentially cause injuries, but what if we're at that worst case scenario? Somebody just broke their arm at the practice, or maybe they contracted a workplace illness, an occupational hazard, and FYI, COVID-19 is now considered an occupational hazard. So now a practice actually is required to have a workplace injury program, which essentially discuss that. If somebody does injure themselves in the workplace, what are your steps to ensure their safety? What are you doing to accommodate their needs? Because they injured themselves on your work site doing your work. So what are you going to do to be able to ensure that they can come back and either work at that full capacity, or maybe, let's say, for example, if this is a dental assistant, they broke their arm, you kind of need that arm when you're working, right? So what if they can't come back as an assistant for 3 or 6 months? You technically have to accommodate their injury, and you can either have them work as an administrator, or maybe sterilization, or in a different capacity. But that has to be outlined ahead of time. You should have the proper paperwork as well, agreements, goal settings, check-ins, and having those report forms to make sure that they're all coming back and hopefully being able to work at that full capacity once again. Now, again, this is why it's important to make sure you have this ahead of time. It's kind of like insurance. You don't call and get insurance on your house when your house is on fire. You kind of do that when you buy the house ahead of time, right? The same thing with occupational health and safety. Now, I know we talked about COVID-19 as now being an occupational hazard, which now means we need to have a COVID-19 safety plan. Now, this safety plan is something that is very detailed, and again, it should be written, but it's essentially your what if navigator. So what if there was an exposure in the workplace? What are we doing to trace? What's our contact tracing? How are we going to notify other employees or other patients? What's our contingency plan if maybe an associate or the one hygienist we have now has to be out for 2 weeks? Or what's the elimination process? Or what are we doing to make sure that they have clearance to come back? What are we doing to clean and sanitize and disinfect the workplace to ensure that it's safe for everybody to come back? And now with numbers rising yet again, this should be ready and available within your practice for that what if scenario if there was an exposure in the workplace. Now, I know we've talked about some of the OH&S inspections, but again, this was another key component that they asked for. The 3 things that they asked for right away when they walked in was your occupational health and safety manual, your COVID-19 safety plan, and your risk assessments. So if you don't have any of those items, I would say out of these 8, please focus on those first 3, because if there are with the number of COVID cases that are rising, we have seen how AHS is starting to, what's the word I'm looking for? Put stricter protocols and procedures in place. Now, if your practice has actually more than 2 employees with COVID, that is considered an outbreak, and it must be reported, and AHS will do an inspection. So again, this is something that we need to be ready for. If this did happen, This is one of the key components that they are going to be asking for. Now, some other elements that we want to make sure that we have are the proper documentations and forms, because not only do OH&S inspectors come in, AHS also comes in, but if there ever was worst case scenario, that workplace injury or an emergency like that happen and an internal investigation has been recommended, or whatever the word I'm in, mandatory, and they're coming, basically, if they're coming to do an inspection, there's many things that they're going to look for. So making sure they have report forms, logs ready on hand. So a few examples that we've kind of talked about already are accident and incident reports. So again, if there was an accident or an incident that happened within the practice, there's a series of questions within that report form that you need to make sure are filled out to cover all of those areas. You should have a housekeeping checklist. And not only a housekeeping checklist for your team, but if you have a janitorial company that comes to clean your office, you need to make sure that they have their own housekeeping checklist that really defines what needs to be clean, disinfected, and sterilized every single day. This is also a requirement for your IPC. We also need to make sure now with COVID-19, we're all wearing way more PPE. So there should have been an increase of PPE policy. A PPE distribution form, a PPE training certificate that was provided to team members. Now, if this didn't happen when you first came back, I would definitely recommend, since we've been doing this for over a year now, we're all probably feeling that COVID fatigue and burnout. It would probably be a good idea for your next team meeting to schedule just a refresher on PPE, how to don and doff. What's the type of PPE that we should be wearing for what appointment? When do we know that that PPE is failing and needs to be replaced? And then making sure that, again, it's almost like a little training log. We're calling it a training certificate that they're going through, and the health and safety representative or committee is also going through and checking off saying, yes, we reviewed this with this employee. They've properly demonstrated that they were able to don and doff properly. And they are understand of the safety violations, because this is a safety violation if they are not properly wearing their PPE. So something to consider to add to that list of things to do. Sorry that I'm doing that to you guys today right now. Also, anything when it comes to waterline disinfection reports, unforeseen events reporting. Now, again, this is something that is a requirement from the ADA&C, especially if you're doing sedation dentistry. So essentially, you need to report any time a patient maybe, for lack of a better word, kind of slipped beyond the level of consciousness that we were hoping to get them to. And we had to give them something to essentially revive them into what they needed to be originally into. Or if they went into cardiac arrest, or even if they were transported to the emergency room that day during either because or after their sedation, or even 10 days up to after their dental appointment, and if they were rushed to the hospital. So these are all things that we need to make sure that we have those report forms. We also come across our health and safety training. Like we have I've hopefully discussed enough that health and safety, not only do we need to make sure that we have written policies and procedures, but we also need to make sure that our employees are adequately trained in all matters necessary to protect their health. Not only is that training necessary when a new employee starts, but it's also a requirement to do this annually. So you must train your employees and prepare them for some of the things that we discussed already: bomb threats, gas leak, violence in the workplace, sexual harassment, fire safety, power loss, intruder in the workplace. Not only does every employee need to be trained on this, but if you are a health and safety representative, or if you are a health and safety committee member, you actually require additional training every single year. So here in Alberta, you are required to have 16 hours of training per year by an approved provider to ensure that you are up to date, because you're the one who's managing and supervising health and safety. So it's important to make sure that you know what's needed, so in that way you can keep your practice safe and compliant. And the last piece is harassment and violence prevention programs. Now, harassment and violence happens more often than it should. This is a very, very serious issue. It can be anything from a single or repeated incident, essentially anything that was unwelcomed conduct, any unwelcome comments, bullying, or actions that is intended to harm another person or a group. And these types of actions really create an unhealthy work environment. It could cause psychological harm to the person that this bullying is happening to, or it could escalate to a physical violence. That's why OH&S considers this to be very, very serious. So if we kind of go through the list here, again, it could be unwelcomed conduct, comments, gestures, or contact, physical or psychological bullying, exclusion or isolation. It's cyberbullying. I know we talk about this and we hear this a lot happening on social media or in schools, but this could also happen within our workplace. Or another item that is categorized under workplace violence and harassment is setting somebody up intentionally to fail, withholding information or giving them the wrong information, taking away work or responsibilities, or sexual advances that are not welcomed. And as a part of this commitment, it's important for practices to make sure that they have the proper policies and procedures in place, not only to prevent this, but also what happens if this happens. In other words, we need to discuss how workers are going to report such workplace violence or harassment. You need to have the proper documentations and investigation forms. And you also need to show within your policies and procedures, how are we eliminating this from ever happening again? We also need to outline how we are informing the policies, the parties that are involved, and the results of the investigation and the corrective action that is taken to one or all of the parties. And then it should also outline how you are going to eliminate or control this hazard. Now, these plans must be kept current and reviewed regularly with your team. So I'm sure all of this information probably blew your mind. I just spoke about health and safety for 40 minutes. It is in depth. There is a lot that needs to be involved in your health and safety program. And that's exactly why Teresa invited me to come and speak today. You know, obviously I just gave you a 30,000 foot view and a high level overview of what is involved in health and safety. And many practices are unaware of how complex this is and what's needed. And therefore, many practices right now are unknowingly out of compliance. And with the amount of OH&S and AHS inspections happening, we don't want a practice to ever be found non-compliant because it can be severe. Now we can, for example, depending on what the violation is, it can be anywhere from a stop work order, it can be a ticket, it could be a violation. They could also have any fines or penalties that are associated with it, or worst case scenario, you could actually be fined or in prison. Now, if you ever want to kind of look at the extreme consequences of violations of OH&S, visit alberta.ca/conviction under OH&S legislation. Now, one of the examples of conviction that happened last year, but dated back, the offense was back in 2017, was a worker who was overcame by carbon monoxide gas while eating their lunch in the lunchroom and died. The company was fined $150,000 and placed on 2 years enhanced regulatory supervision. Now, I hope none of that ever happens to you, but it does paint a picture of how real the situation is and how it can escalate to the worst case scenario very quickly. So we need to take action right now to do what we can to minimize or eliminate any potential hazard or accidents from ever happening. Now, I'm sure if we press fast forward to like 2023 from now, I'm sure we are going to see a lot more convictions because of COVID-19. A year after we've seen some layoffs and temporary layoffs that happened from last year, we're starting to see more and more lawsuits come from that. So I'm sure we're going to start seeing more and more OH&S violations coming from the time that we're living in right now. So our goal is to help dental practices get compliant, to make sure that you're following all of these laws and requirements. And I know Teresa had mentioned what we do here, but I just want to give a high level overview. So not only do we set up your health and safety department, but we create all of those necessary manuals, forms, and systems. So all those 8 components that we talked about, we create everything for you. We also train the owner, we train the health and safety representatives or committees, and we also are an approved occupational health and safety training center, which means that we provide the OH&S trainings like WMIS, those 16 hours that you need every single year as a health and safety representative or committee member. We can take care of all of those pieces for you. So things like violence and harassment programs, health and safety representative certifications, health and safety committee certifications, those are all things that we can take care of for you. And I'd love to extend, just because you're here and you guys have listened to me for the last 40 minutes, I'd love to extend a free health and safety checkup for your practice. If you do have any questions about health and safety, we'll take a look at what you have in place and provide any recommendations or opportunities that exist to be able to support you in those areas to make sure that you're compliant. And of course, for practice owners to be able to renew their license before November 1st here with the new practice permit renewal program. So that's it. That's all. I'm sure there's going to be a lot of questions, so I'll just let Teresa take that over, and I'm ready for all of that.
Okay, awesome. This has been enlightening for me. I think for probably a lot of people, because there's lots of things that I obviously don't know about, and this is not my area of expertise, and nor do I pretend it to be. And so this is good for me to learn a little bit. But the questions that I had, and anybody else can chip in as they come about, or maybe I have the same questions as you guys. So you said, and because I'm not fully aware of all the AD&C requirements, because I don't go around listening to what goes on all the time. I just, as they kind of come to me, then I'm like, oh yeah, it's something we need to deal with. And then I deal with it, I think, like most people. So the first one is, you said this is all due for that practice permit renewal is November 1st, right? So I wanted
November
to highlight
1st.
that, which is good for me to know. That means we have months to get ourselves together. And then, okay, a couple of things that came across my mind as we kind of went through this was, where do we get forms, or is there templates for forms, or is it do we make them up ourselves type of deal?
There are a couple of sample forms on the Alberta, on alberta.ca. If you go under occupational health and safety, there are some sample forms, but the majority of them, of what we discussed, will not be in there, just because it's very generalized, right? And within our industry,
niche, like dentistry,
because even one in specific is the new OH&S acceptance letter for needle capping. So that one from the AD&C is a requirement. Now that won't be obviously listed on the alberta.ca website, but that's something that is, again, something that should be posted on your bulletin board. Everybody needs to initial and sign off on it. And then if any hygienists do local anesthetic, then they need to have a certificate of their local anesthetic on the wall. That's the only reason why I know that is because, again, we helped a lot of practices pass inspections that have been happening lately. So that's another avenue that they're going to ask for, is they're going to be looking at that OH&S acceptance letter.
Okay. Excellent. That's good to know, because I was thinking, well, if we tend to want to do some of it ourselves, that's great. But if there's no template, then we have to come up with something else. It just takes a little bit more time. And then now you kind of mentioned something too in there, which I thought was interesting. You're you set it up and it constantly needs maintenance. And I remember when I was doing the HIPAA and PIA stuff before, and how when we set it up, it's not something you set and forget. You constantly, anytime something changes, you have to change the compliance with that. And so so that's something we do. And I think you had mentioned, if you're doing sedation at all, it's every 6 months, right? Just to recap that. And then if you are doing non-sedation, no sedation in your clinic at all, then it can be done annually. Is that the overall view?
Annually, or anytime a new hazard has been introduced. Right. So if there's again, a new chemical or a new product that we're using or a new equipment, that has to be a new policy has to be created for that, and a training and a hazard assessment.
Okay. And then the other thing I was going to ask, and maybe you have some idea of this, or maybe you like to talk about this afterwards if people can reach out to you, because you have all your information on here, but what is the general cost of getting you guys to come on board? Like, are we talking $5,000? Are we talking over or less, kind of like for that compliance, so that we don't have to set it ourselves and we can make sure we're completely compliant? Or is it just vary per clinic?
It varies per clinic. For example, if your office has more than 20 employees, then there's a health and safety committee. So there's more report forms and things like that are required for that.
Okay.
But to give you an example, because we have different types of packages. So for an office that's looking just to create their HR, their health and safety, that's as low as us taking care of that for you for $400 a month.
Okay. Yeah. And you basically keep up with the maintenance on it all the time. You phone us, check in. Oh, did anything change here and that? And I think a lot of our clinics, so I don't know about everyone, but I think for some of us, we use like Bright Squid for like our PA compliance. So it would be something similar to that. Then we just pay for the monthly maintenance. Monthly maintenance, and basically it just gets taken care of. So they phone us, they check in. Oh, did you hire someone? Did you do this? And they just change all of the little things that go along with that.
Yeah.
Okay. Perfect.
So there's a couple layers to that monthly. We also have an online component. So we have an HR software as well. So it's a digital employee file in there. It stores all of your HR and OH&S forms where you can send electronic signatures, sends you notifications when there's any changes or when it's time to do, CPR or anything like that to help stay compliant. And then also a new feature that we're launching within our software is you can actually do health hazard assessments within there. So you can electronically do those forms, take pictures of the work site, upload them in there as well. It'll timestamp it. So there's that layer. Again, monthly support if we're basically your on-call HR, OH&S advisors. If you have an exposure in the workplace, emergency grievance, or you just got a call that you're getting inspected in a couple of days, you call us, we're there to support you. And then we also do the annual compliance and employment standard updates.
Okay, awesome. Is there anybody else that has outright questions at this point for Samantha? You can unmute and just pop your head in and say something, or if you can send it through chat if you don't want to talk, and that's fine too.
Question.
Okay, sure. Go ahead.
I'm just wondering, when you talk about having things in place for, say, a dental assistant who breaks her arm and has to maybe be working in another role, or if somebody has COVID, is it office policy that would supersede your OH&S policy in the sense of legally, whether you have to bring somebody in even if they're not capable of fulfilling their role? Do you understand what I'm asking?
Mm-hmm. No. So, I'm going to give you the typical HR answer that you're going to get from an HR professional. It depends. It depends. It's really, okay. So to kind of give you a pretext to this is that human rights and employment standards are always going to trump what your office policies are. So for example, if, let's talk about COVID vaccines. If, it's a what's the word I'm looking for?
Highly suggested
to get a COVID vaccine, but it cannot be a mandatory requirement because of human rights. If somebody does not want to for religious reasons or for medical or health reasons, but if that employer terminates that person because of that, human rights is going to trump what that employer does. So it's going to be the same thing for OH&S. If we have to show the duty to accommodate and follow that, not only with, human rights, but also what our employment standard says.
Thanks.
So without going too much down a rabbit hole, I do have a question about that.
Yeah.
So what do we do in that situation where we know, okay, so obviously vaccines are super important for dental at this point. Not mandatory, but like, again, highly suggested, right? And there's a lot of pressure from people to make sure that we're getting them, which is fine. But like, what happens if someone says, yeah, like I'm not getting it, and that is part of your office policy to be vaccinated or whatever, because it is IPC standard for like regular vaccinations, right? To make sure that you're up to date. So what if someone says, yeah, like I'm not getting that? Do we get them to sign like a waiver? Like, was that something that we like talk to them about? Basically a disclaimer saying we like highly suggest you do this, but if you don't, you're on your own, I guess, at this point, because IPC asks us to make sure that we have like their Hep B and all the other stuff on board with that, right? So,
well, IPC does state that, again, the same thing. It's recommended for dental health care professionals to have this because of the type of environment that we work in. So it's the same, it's recommended, but there's a few layers that should be there to really protect you and mitigate your risk in this situation. So ideally, if I had my magic wand, and of course, if this was in an office that we helped set all these things up, there should be a discussion about vaccination right from the offer letter. The offer letter should indicate the workplace hazards. They should be aware of, the exposure, and it should be recommended that they have these vaccinations and requesting a copy of their vaccination records. Now, it should also state in there, if they decline that for whatever reason, then they should sign a declination form, which essentially is saying that I understand the risk of working in this work site, and I will be exposed to XYZ type of disease, but I understand that by not taking that liability is on me and not on the employer. But they can revoke that. So later on, if they decide that I do want to get those vaccines, then they have to sign another form revoking that form. So a lot of forms. So that place definitely.
I have a question on that.
Yeah.
Sorry. I worked in HSE, and there's always standard protocols process, but there's a Privacy Act, there's what's mandatory and what's not mandatory, what's recommended. So it's a fine line. So if you could do that kind of documentation, I definitely want to get legal involved in that, because
Correct.
I know right now with the protocol with COVID, you go to the office and every day you sign in. Yes, I have no fever. Yes, I acknowledge I'm going to work here. And there's a document in place now, I think, for most clinics, correct me if I'm wrong, that I'm fully aware of the potential risk, and I'm okay with that. So that's a standard thing. I know, because with like dentistry, we're not unionized. And so when I worked with HSC, there's always cases with workman comp. So we had to be aligned, right? So it's different with dental because you don't have that regulatory body.
Yes, exactly.
Right. So I'm just curious, like the document you're saying for hire, yes, you want to make sure this is our expectation. If they decline, you don't have to give them an offer a job. You just keep moving. So that's a fine line. It's a very, I would also say that's legal, right? To watch on how you do that.
Especially, well, like you said, they have that opportunity. That offer letter is there. They can refuse that offer letter if they decide not to sign it, but at least they were made aware of that. It's much harder when you hire somebody, they've signed that offer letter, and then later you're trying to rescind it and say, nope, I take it back. I don't want you for this position anymore. That then opens you up to much more legal risk at that point, because then they could say that you are terminating me because of discriminatory, my religious reasons or what have you, of why I'm not taking that. So again, there's so many layers that need to be considered, but it's really important to have those policies in place. Another thing that we recommend in employee handbooks and in OH&S is to have those voluntary vaccination policies, communicable disease policies in there as well, just so in that way we're fully educating everybody of those hazards. And then of course with OH&S, as you're aware, they have the right to know, they have the right to refuse dangerous work, what they consider dangerous work. So as long as the practice is covering all of those areas, then hopefully that mitigates that risk. But you brought up some really good points, and that's why it's really important to make sure that these aren't verbal discussions. These are things that are in writing and have been communicated and signed off on and documented and so on and so forth. It's a good point.
Yeah, and I think that's really smart that you just said that. And the key is like verbal. So yeah, verbal means really nothing to anyone, and it doesn't hold up anywhere. So you got to make sure everything's in writing to make sure that you are mitigating your risks. And it's like a little bit, and other people can kind of chime in too if they want, but like it's a little bit intimidating, all of this information, and it's not. Obviously this isn't meant to like scare us or to have this thing, but it's just like there's a lot, because dental really hasn't delved into this at all, and it's never been a part of like our workflow or our environment. And it makes sense that it does make sense that it's being a part of it now, and we're like integrating it, and it's really, I think, good for the industry. But it is like, it's a lot, and I feel like if we are feeling unsure about the decisions and the things, and maybe reaching out to have those conversations would be smart with someone who is capable of doing it and just gives you a better idea of what's going on and what you need to be doing. Because I feel like even for me, like, capable, probably I have a fairly good understanding of all this because I haven't just worked in dental my whole career. Much like Cindy, like I understand how it works. But it's still a lot of work to put this all together and to maintain it and to make sure that it's being done. And part of being an office manager is no different than being part of a dentist, or being a dentist in the sense that you know your scope of practice and you work within your scope of practice. And then if it's out of your scope of practice, you ask for help and make sure it gets set up properly. But you still have some time to kind of patch things together at this point and get things started if you want to do this on your own. And I think, there's a lot of tremendous information in here, and I'm super appreciative of like what you've done here, because it gives me a lot of ideas on where our stuff is lacking and what we're doing. Because as we patch our stuff together now, I need to a lot more to consider than I thought. Okay.
Well, I appreciate you inviting me to come and speak about this. And, this is something that, I can completely relate, because coming from an office manager and with a dental assisting background, like I just knew the clinic inside and out. I knew IPC really, really well. And that was about it. Now I find myself leading and managing 50 employees. And now I'm dealing with terminations and grievances and all of these other things that I had no schooling or background in. And when I started, this company and hiring some really great HR and health and safety professionals, then I started learning so much. My mind was blown, and I still learn every single day from my team. So, it's definitely, we're here to support practices. And we actually, if this is something that you are contemplating on doing on your own, we have an occupational health and safety boot camp that's starting June 21st. It's a 10-week course that goes through basically brick by brick on legislation and how to build everything. So we go through workplace injury programs, which should be in it, like line item by line item. So it can really help you with that. Another great part of that is that you can actually qualify for the Canada Alberta job grant, since it is training for your team. So you could qualify to get 60% of that cost reimbursed. So something to consider as well, if you're interested in.
You send out that
awesome.
information?
Yeah, we can get it from Samantha afterwards, and I will send it out in a follow-up email with everyone, and you guys can look into it and what they have to offer, because I know they have lots going on, just education wise for dental, which has been fabulous. And they have tremendous amount of information pumping out all the time. So it's awesome. Okay, and is there any other questions that people want to chime in on that you guys want to ask? Or I haven't seen anything come through in the chat, so I just want to make sure I didn't miss anything else from the people.
It's really good information.
Yeah. Okay, good.
I appreciate you guys being on here with me, so thank you very much.
No, it's super awesome. Okay, and then we'll just spend like 10-15 minutes if people want, if there's having like operational issues that are going on in the clinics. And let's just see here. There we go. I'm just going to make this bigger on my screen. Okay. If there's operational issues you guys are having that you guys like to talk about, or things that you want to troubleshoot through, I mean, we have some great minds here tonight. And I'm seeing some really great people on here tonight that I know have different perspectives than probably other people that are on here tonight. So if you guys have operational questions, now's your time to kind of shoot out things that are going on in your clinic that you might want some help with or don't understand. Now's your chance to chime in. Let's see.
You know, we just talked about occupational health safety, but I'm still perturbed a little bit about on a contract about their suggesting about vaccination and so forth. Doesn't that impede on their privacy?
There is a fine line with the privacy. So basically a practice is just asking, like a practice technically cannot ask, what medical conditions do you have? Why don't you want to do this? What's your religion? They cannot ask. Basically, all they can ask is there a reason why you don't feel comfortable taking this vaccine? And if the person says yes, because of religious reasons, or yes, because of that, they cannot ask any further questions, and they should not be asking any questions because, like you said, that is a violation of privacy. So again, it's a very worded, very just essentially, I shouldn't say that it's worded to the point where it's basically essentially saying the same thing that the ADA&C is saying. Hey, we recommend you have this because it's going to help with any exposures that this workplace has. We recommend you take that, but if for whatever reason, and again, that's worded specifically of if you decide not to because of medical, religious, or personal reasons, there is a declination form to sign. So essentially just kind of stating that and not asking any further aside from, no, I don't want to take that vaccine.
I'm going to push the envelope a bit more. Why have the declaration form?
Essentially, that is just kind of showing that the practice is saying that you are aware that because without having this, you could be exposed to this. And so you understand the risks. And that person is saying, okay, I understand the risks of declining getting a vaccine or having this vaccine.
Okay.
Yeah, because basically I think, Cindy, if we'll say that this person doesn't want to get their vaccines for their Hep shots, right? And so they go and they all of a sudden have a needle stick injury, and then they end up getting contracting Hep, and then they could potentially come after the employer litigation wise, just saying that they didn't protect me and blah, blah, blah. And because they didn't have a declination saying, I understood all of my risks, then the lawyer would be, or the employer would then be held liable for that indiscretion, even though it doesn't make sense. And the person probably knew and they chose it. But if it's, again, this is not like a verbal thing, this is like a written kind of like exposure, just protect your risks in that sense. And so it just protects the company or the corporation or the dentist, whoever's owning that business, that they're not going to get sued. Or if they do get sued, they can say, well, look, you signed this form, you knew, you were fully aware, we went over it with you. This wasn't signed under duress. This was signed literally before you started working. And that's why I think Samantha says, ideally in clinics that she takes over is like, from the beginning, it's all taken care of, that we kind of do this. And it's not to say that you can't do it halfway through, because you can. I think, it's better to have it done now versus when an incident happens. So I think you can kind of just work your way through it if you have to, but ideally to have it right in the offer letter would be the best. But yeah, and I think even dental clinics, lots of them don't even do offer letters. So there's that too. So there's a starting point for everyone. Samantha's probably cringing so hard, but that's dentistry, and we're gonna get there, guys. We'll get through this.
Well, just one thing to remember as well is that that's considered an occupational hazard. So again, just, with OH&S, that really needs to be outlined, all of the potential hazards, and the employee is made aware of that. So one of them being, needle stick injuries, hepatitis, I think even just the list that IPC has is half of the diseases I haven't heard of in a long time. But, and now we need to add COVID-19 to that.
Yeah, awesome. Well, if there's no other questions for tonight, I really appreciate your time, Samantha, and for all the stuff that you taught us. I will follow up an email, and I did record this for people who want to like revisit it because there was a lot of information and you might want to watch it again and kind of just go through. But I think the boot count sounds really good for the DIYers, the ones that kind of want to do it themselves. And then for those who are really like invested in doing their own, I mean, you gave some good websites information on this as well to like pick and pull from. But then obviously they can do like the full meal deal with you as well if they are just like, I just don't even want to deal with this. Let's get it done.
We'll save you the 250 hours that it would take for you to build one.
Yeah, and it's not a small thing. It's crazy because even when I was doing the PIA for my clinic, which is
huge.
Yeah, it took me, I think it was 60 hours. And yeah, it was a lot. And that was like me I had to like digest it, learn it, and then regurgitate it and then build it out. And then that thing just doesn't stay. It's not like set it and forget it, you're constantly updating it. And so like, there's just a lot that goes into that. So same thing. If you want to put the effort into it, that's fine. But again, your money might be spent working on production versus doing on other things. So your call, what you guys want to do with that information, but I know that they can reach out to you, Samantha, if they have need of assistance or help or just ideas on what they want to do with that. And we really appreciate your time. So thank you so much for coming.
Thank you.
It was a good time.
Thanks, everyone.
Yeah.
Enjoy your evening. Have a good week.
All right. Bye, guys. Thanks for coming out.
Thank
And what was that? Okay. I thought someone said, wait. Okay. Take care, guys.